It's hard to know what size or what's going to fit, and everyone's bodies are so different. I have short little ladies who are, these garments are way too long-waisted for them, so sometimes we have to cut them and manipulate them. So if something's not working, please let your surgeon know. Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Ashley Amalfi and joined with my co-host and friend, Dr. Smita Ramanathan. Hi Smita.
Hi Ash. Hi everyone.
Welcome you guys. This is Show and Tell continued, and we are continuing the plastic surgery lingerie show. Don't get too excited. This is not that cool.
It's not the fun kind. Nope.
Yeah, I'm like anticipating all the crazy memes that are going to happen when my friends see these. But we're going to talk about compression garments today. There's always so much questions about like, what should I buy? Do I order my own faja? Are you going to provide this? What do they look like? What do you tell people in the office, Smita? Like, how do you kind of explain what their compression is going to look and feel like and how they're going to transition?
Yeah. I mean, so obviously a lot of it depends on what surgery you're having. If you're having more excisional procedures, if there's a lot of liposuction combined with it or liposuction alone. But, in general, I basically talk about just compression in general and how important that is, right? And so I usually have patients wear some sort of compression garment for 6 weeks, night and day. So I'm like, take it off to shower. If you need a breather for an hour or two, that's fine, but you're going to wear it the rest of the time. After the 6 weeks, then, always the more you wear it, the better, but you can maybe wear it at night or while you sleep. But again, the longer you wear the compression, the better.
Yes.
But, immediately after surgery, there's a lot of swelling, and we want sort of a tighter compression that's really going to help minimize that swelling so that you heal and recover faster. And then we can sort of downgrade into softer and stretchier compression where you're still getting some support, but not as intensely as you are right after surgery.
Yep, I totally agree. All right, you ready to see some of this crazy stuff?
So let's do it.
Oh, it's so amazing. Just wait. Well, at least it's black. I usually do black just because if you bleed on these things, you don't want them to be a mess. So that's the one redeeming quality we have here. But essentially, they kind of look like Spanx, not to use a name brand, but this is like a surgical compression garment. It looks like kind of like leggings, and they're either shorts or a little bit longer, depending on where you're having lipo. This would be for a tummy tuck. The thing that's kind of different about these surgical ones is that they have a zipper up and down the side. And the other redeeming quality is they are crotchless so that you can pee, because taking this off is like an event. And so you don't want to have to do that because you're hydrated and having all these IV fluids and peeing all the time. You don't want to have to take this thing off every time. So that helps you go to the bathroom. The zippers help someone else get them on and off for you. There's little clips and zippers. My advice is when you're actually taking this on and off for the first time, that you kind of lay down and have your companion help you get these on and kind of button and zip one side at a time. But essentially they're just like bike shorts or leggings, and they're just really, really, really tight. But honestly, a lot of patients say they feel good. So, whereas the bra, people will complain that it feels a little bit tight. People feel good and comfortable and safe when everything is held in like this, especially after a big surgery like liposuction or a tummy tuck. How do your patients react to these early garments and compression?
Totally the same thing. I think having that extra support, especially as you're first starting to get used to moving around, even just sitting down and standing, we don't realize how much we use our core for every little thing. And so, especially after a tummy tuck or liposuction, when you have that extra support there, it just makes it feel better. And so I agree with you. I think everyone loves them. It's annoying and hard to get on and off, especially the thicker garments. I mean, just imagine getting into like Spanx, right? Nobody likes getting into them, but after surgery, it does feel good anyway.
Yes, absolutely. The other kind of early garment that you can wear, especially depending on where you're having your surgery and what hospital setting, is an abdominal binder. Do you want to talk about that one a little bit, Smita?
Yeah. So I typically use abdominal binders with tummy tucks, and if I do liposuction in like around that area, the flanks or love handles. And so it's essentially just a big elastic band, right? I mean, that's as easy as it can be. It's a big elastic band. It's typically white. Some of them have different panels of Velcro, so you can adjust the top and bottom separately. But typically the ones in the hospital are just one big piece of Velcro, and you wrap it around, give it a little pull, and you Velcro it to yourself. So I typically like that after surgery just because I think people can adjust it based on how much their swelling, goes up or goes down, right? In the first week, there's so many fluctuations. And so it gives you that opportunity to make the adjustments. But the garments, I think, are definitely a little bit more comfortable because the elastic band, the binders are thick elastic. So there's nothing comfortable about them.
Nothing. And then, after that initial period, once your drains are out, the having a binder or having a crotchless garment is nice because you can pull the drains out through there. But once your drains are out, after that first month, a lot of my patients will transition to something that's still compression, but not as tight as those stage 1 surgical, immediate compression. And so a lot of our patients will just buy like their favorite brand of Spanx or Skims. So you want to look for something there that, especially like after a tummy tuck, is kind of high-waisted. So these just look like a little bike short. And they're a softer material, they're thinner, they're easy to wear under clothing when you're getting back to work or school. And no one's going to really notice that you have this under your clothes. I mean, half of these women already joke that, well, they're just kind of wearing that anyways. They're like, oh, I have plenty of that stuff at home because they're trying to tighten their belly. So this will be very comfortable for you to wear after surgery. I mean, the other interesting thing is you never really know what size you're going to need, and that sometimes you need to go down in size because sometimes you'll be in a size of these and it'll be working really well. And then all of a sudden you start swelling again because they kind of loosen up as you continue to shrink down. So you might want to buy 2 sizes.
Yeah, no, absolutely. Buy a couple sizes. And, I always tell people to try different ones on. You make sure the biggest thing that I worry about is when, patients buy their own garments and the seams can sort of cause indents in any area where we did liposuction especially. And so always, get different kinds of garments, try them on, make sure they're not leaving indents, wear them for an hour or something and take them off and just double check everything. And then you can return what doesn't work, but at least you have options.
It's hard to know what size or what's going to fit, and everyone's bodies are so different. I have short little ladies who are, these garments are way too long-waisted for them, so sometimes we have to cut them and manipulate them. So if something's not working, please let your surgeon know, and we can tell you what can we do or what can we try to make this not only useful, but comfortable for you too, because it shouldn't be horrible.
No, nothing we do really should be horrible.
No,
it's all there to help you at the end of the day, and it's short term. So
I'm sure some of you tell me how you want to burn and throw away all these original garments, but they are really useful in the beginning. So nothing to be worried about. Nothing too crazy. They're functional and they do their job. And then when they're done, you can definitely be done with them.
Absolutely. Throw them in the trash.
Awesome.
All right. This was awesome. And we've got a lot more coming your way, guys. A lot of show and tell. So stay tuned. Subscribe, Lipstick and Lipo. We're on YouTube and Spotify. I'll see you next week, Ash.
See you guys.
Bye.